The role is pediatric specialist registrar. Setting is postnatal ward. You are talking to Mr. and Mrs. Fur, parents of 2-day-old Tony. Background information: Tony was born a term after an uncomplicated pregnancy to a preemie mother. His birth weight was 3.35 kg. Routine newborn examination by the SHO on day 2 revealed a cardiac murmur. Subsequent review with echo scan by the consultant confirmed the small VSD. The parents are suspect about the diagnosis. Parents are upset about the diagnosis and also about the fact that this was not picked up on the antenatal scans. So the task is Tony's father is asking to speak to someone. You are the registrar on call. The consultant has gone home. Explain to the parents the diagnosis and planned management.
Mhm. Just 1 minute.
So
I
Dr.
will.
Rahel is
Just 1 minute.
okay, no problem. Uh, Dr. Rahel, will you set the time as well?
Uh, Time, I cannot, my phone isn't charging. If you
No
can set the
problem.
time.
I will take no problem. 6 minutes and 9 minutes. Don't draw the picture before scenario. You have to draw at that time, right?
We can draw. No
Ah,
problem.
you can. I don't know.
Yeah. Outside we can draw.
Okay.
They are giving paper.
So 2-day-old Tony and Mr. and Mrs. Park. So you may start, Dr. Rahel.
Just 1 minute. It's not working. Picture. I cannot draw.
Why
Okay.
you draw before, no? You draw it, right?
I don't know. Stop it.
But I saw it was there. Just
It's
you
coming now.
delete it.
My screen is not coming. See, I'm trying.
No, now it's not coming. But I will share again this screen whiteboard.
Just 1 minute. Let me draw first.
Try now.
It's coming.
No.
I'm
Yes.
trying.
Yes.
Yes.
No.
Yes.
Okay. Hello. Good morning.
Good morning, doctor.
I am Dr. Adnan, one of the baby doctor. I am talking to Mr. and Mrs. Firth, parents of Tony.
Yes, doctor.
Congratulations for a new addition to the family.
Yes, thank you, doctor.
Mr. and Ms. Faith, would you like to be someone else to be present, or should I continue?
You can continue. My wife is uh, right now not here. She just went to take a coffee. So you can talk to me.
Okay, that's fine. So, what are your understanding so far about Tony health?
I have been updated by one of the staff. She told there is some hole in the Tony's heart, and it made me really upset. We all of us we were very happy on the birth of Tony. You know, it was kind of a new extra bundle of joy in our life. But this news of hole in the heart makes me really upset. Now I'm quite worried about this.
Yes, you are right. I can understand your worries. Let me assure you that Tony is doing fine, first of all. And I will tell you that unfortunately, Tony's heart is having a hole, but it's very tiny and very small. So, let me explain what is this hole, and we call it ventricular septal defect. So, it will be better understanding. Okay, and I will draw a picture.
Okay.
Draw a diagram for you. Okay.
Okay.
So our heart is made up of two four chambers. Two is above these chambers, two is above, we call it atria, and the two are below, we call it ventricles. So between these chambers, there is a wall, we called it this wall, we called it septum. So this is actually separating the right side of the heart and the left side of the heart. The right side is having blue blood, on the left side is
But,
pink blood. Are
but
you getting my
doctor,
point up to
yes,
now?
I'm getting your point, doctor. But I heard I have my friend whose daughter also have same kind of the hole in the heart. I don't know
Mm-hmm.
exact what size of the hole, but she died because of some problem in the heart. Is this the serious condition for the Tony?
I'm really sorry for your friend's this daughter. Uh, uh, Let me assure you that this is a very small hole in the heart. This is actually between the lower at the wall of the between the wall of the lower chambers. So it's a very small, and Tony is doing very well, fine. So most of the time, this hole close by itself. As the with the passage of time, as the child grows, heart is also growing.
But doctor, why the we did all the scan, all my wife visit, we did the scan, and why this doctor did not tell us that Tony has this problem? We could have taken some treatment so that hole could have closed.
Yes, I can understand, Mr. Fit, your concerns. Your concerns are very valid, and jelly scan is a very useful technology. But it has some limitations also, as in the condition of Tony, there is a very small hole is there, so it can be missed easily. Are you with me?
Yes, doctor, but it's not one time we did scan. We did scan from throughout the she conceived. We did serial scan, and throughout this it got missed. How is it
Yes,
possible? I want to
yes,
complain against that doctor.
yes, I appreciate your concerns. This is the part of follow up. Everybody is doing scans like this, and as I told you, this is very small, so it can be missed. Sometimes it peak.
Okay, so doctor, now what will happen? Will you start some medicine for Tony?
Yeah, that's a good question. At the moment, Tony is doing fine. He's very well. There is no need of treatment, but I will refer you to the heart doctor clinic, and Tony's condition will be monitored there time to time for his growth and for his health. And the heart doctor will tell you further more about this.
Doctor, I
Are you
read
get?
about yes, I read about like in this condition. Sometimes they are doing surgery also. Will Tony also will need surgery?
6 minutes
Uh,
past.
okay. Sometimes they are doing surgery, but it depends upon the Tony's condition. Let's hope for the best. As I told, it's a very tiny hole. So most of the time, these kind of small holes usually closed by their owns. As the child grows, heart will also grow. So let's hope for the best.
Okay, doctor. What my all previous baby, I put one tattoo on them. Is that okay if I put a tattoo also for Tony? It is there in the
Yeah.
future. Is that okay?
uh, Yes, I can understand. This is a valid concerns. I was coming to that. There are some advice, some few things which you should be avoid, like the tattoos, or you should be in follow up with the teeth doctor every 6 months ideally. because the child who's having this small kind of hole in their heart, they are at risk of developing infection in the lining of the heart. Are you with me?
Yes, doctor. So
So,
what
so
should I
this
do?
the best thing is should be avoided, because bugs can through the bloodstream can travel to the heart and cause the infection of the lining of the heart.
Okay. So will you start antibiotic for Tony?
At the moment, Tony is doing fine. There is no need of any treatment. We will refer you to the heart doctor clinic, and they will tell you furthermore. They will advise you.
And doctor, I want to complain for this doctor who did scan.
Yes, for there is a uh, you can do that. It's your right, and there is a procedure. I will tell you about that. Okay.
Okay, doctor.
So, Mr. Firth, I think I have given you a lot of information in a short period of time. If you have any other concern, we can arrange another meeting and we will refer you to the heart doctor also. You can raise your concerns there also. Should I rephrase what we have discussed today?
Yes, doctor, it's okay.
So we have discussed about Tony's health, that Tony is having the hole in the heart that is called ventricular septal defect. So, as I told you, Tony is doing fine. We will refer you to the heart doctor, and at the moment there is
Time
no.
is up, doctor.
Thank you, Mr. Fair.
Thank you. Thank you.
Yes, Dr. Rahel. Sorry, Dr. Hiren. Your feedback, please.
Yeah. So, how you feel, Doctor Rohel? How did you feel?
I think okay. I have given all concerns.
Yeah.
I have given
So,
myself.
yeah, you did good. Uh, Only a few things from my side. Your introduction, you came to the point. Your agenda also you clarified, and you explained. You made a drawing about the VSD. Also, you explained that was nice. Only thing about I mixed little bit in this scenario. I put about like incident report or something like complaint that probably you were not expecting. I felt like that, and
Mhm.
about the advice also for infective endocarditis, you instruct me. That was also good. You also advise about not to do the tattoo. That's also good. Only remaining advice was the action plan, like if this child
Yeah, yeah. I was
difficulty,
if he's having refusing feeding or
yeah,
turn blue or something, I
sweating,
should come
refusal
to that, but
feel,
there was no time.
yeah, change in the color, then you should go to the
Yes.
GP for that. That was remaining. You did not mention at all
Only
about.
that one remains.
Yeah,
Only action plan remains.
yeah,
I
and
know this one.
unnecessary. You just put the every 6 monthly teething doctor. You specifically use teething doctor. This thing. No need to
I
mention.
was thinking I should use dentist, but I don't know. Dentist is I don't know. This is jargon or not. So that's why I didn't
Just,
use.
you
But
know,
they
small
have written
baby.
in the NHS website. They have written ideally 6 months should be follow up.
Yeah, it was this is a small baby, just 2 days old baby, right? And no need to visit the dentist doctor or the teething doctor for every 6 monthly.
In the long run, not now. I know this
Yeah,
one, not now. In the
yeah,
long run.
So better not to explain the things which are very in the first visit, and you will explain the things which are after 1 year or 2 years.
yeah,
So
Okay.
management, you should explain which is acute means recent management. You will not go
yeah.
very far away. And small hole, maybe it will close it by itself. No need even dentist and these things.
Yeah, yeah, yeah.
And about the medical management, you could have just like add 1 or 2 lines about like you if there is a sweating and all these features. I ask like whether he will need surgery. So you could have said like first it's very rare possibilities, but if in case it is need, first we'll try with the medicine. If medicine will not work, then and only then the heart doctor will advise possible need of surgery. So
Yes, I told that they are doing some surgeries, but in Tony's condition, it's a very small, and I told that most of the child, they, with the growing of heart, this holes
get
closed
close.
by themselves.
Yeah,
So
yeah,
this
Yeah,
will
yeah.
be
You informed this.
yeah. You
this,
informed.
Already.
Just
this
I'm.
kind of reassurance.
Yeah, just
Yes.
I'm telling you for
Okay.
management. That was the only thing.
Yeah.
Okay. Okay. Thank you. So, anyone else has the comment in this one? Anyone else want to add
Yeah,
something?
Otherwise,
Yes,
very
please.
actually, I don't know
go ahead.
what
Very
is
nice.
there is anything like piercing, tattooing is contraindicated in condition or not. I don't know.
Yeah,
And
this even not appropriate in
yeah,
2 day old
it's
baby. They will not go for
yeah.
tattoo, right?
Actually, it was
So
Dr. Heron point of view to just prompt him to give
Yeah, yeah.
something like first suggestion. So it was, I think, prompting rather. You want to know
Yeah, yeah.
what he
I
will
wanted
say.
to,
Prompt.
to prompt him, like tell about this advice.
Yeah,
So
you want to listen what he will tell.
yeah, yeah.
It was like that.
okay. And
And
other thing,
secondly, you
Doctor. Yes, Irfan, please.
yeah. Usually we say this is a very small hole. It's rare he would need any surgery. But if he needs
Yes.
surgery, it's very good prognosis, good excellent outcome. Then we should give this reassurance to parents. In the case he needs surgery, very good outcome.
Mm.
So that he should get happy. And this thing is very curable, not having any problem in the life. And I don't know how about this one, antibiotics. I mean, what is, we are not giving any prophylactic antibiotics.
Yes,
No,
yes.
no, small VSC, we will not give.
Yeah,
Small
no,
VSC, we don't need anything.
just I'm telling you, even
Mm.
it's a BSC otherwise, but there is no role of prophylactic antibiotics nowadays.
No, if you start anti-failure medication and it's a large VST, then they are
That
needed.
is something prophylaxis. You mean?
First 2 years.
Yeah, yeah, first 2 year.
Mm.
That is something else going to
You can
come.
send this
Anyway,
one.
this
Mm.
was any, and regarding Jerry scan, you can say, okay, as Dr. Hale told that this is useful technology, but as this hole is very small, it's difficult to pick it up for anybody. So he should get reassured there. He should not go for any complaint because he
Yes,
should tell
yes,
this
this
is very
was,
small hole.
you're right.
This is very small
Mm.
hole. It is very difficult to pick it up. Okay, this is quite natural. Anybody can do this thing. Okay, so that he
Yeah,
should become
don't say the
happy.
missed. Don't say it's not possible to pick up small holes. If you will
Yeah,
say miss, it means the fault of doctor.
yeah, this was the thing. And he should be reassured at that point so that he should
Yes.
not ask me, I will go for a complaint. So he
Actually,
would become
Yeah.
Dr. Bhatti, this is the same phrase is written in the NHS. It can be
what?
missed easily. I
Yeah,
got
yeah.
from there.
No, you don't understand the point.
Yeah,
The
I
point was,
understand. No,
the point
actually, there was.
is,
I will
it's
tell
a
you,
tricky
there was
point.
no time. No. Actually, from my side, I will tell you, there was a little time for me to study because yesterday I have call and night duty. So in the
No, that
morning I
was,
came 7 o'clock.
no,
So in the
my
night
point.
duty, I got a chance to study from this NHS website only.
Yeah, this is, I don't know, just I'm telling you, it
No,
means
you
it
did
can,
well.
you did well. I'm asking you, it
Yes,
means it is missed
Mm.
because of the hole is very small. It is not
Uh,
mistake.
Mm.
In this,
Okay.
they wrote like that.
yeah,
Mm.
yeah.
Any
Okay.
two way, yani it can be missed. Here, suppose Dr. Irfan is doing, he can pick.
This is the last one of the nutritional
No, we did before
assessment,
also this thing. I
and
remember.
after that there's abdominal. This total 4 cases. No? One was
No, I
chronic
mean,
lung disease, one was heart disease,
no.
one
I'm
was
asking you.
cerebral
We
palsy.
did this scenario before also. I think Dr. Rifat did.
Before the Ramadan.
Yeah. I remember. Yes.
before the Ramadan, but we are
Yeah,
restarting it again.
just
Yeah,
I'm
before
recalling
very
this thing.
fast. Dr.
Yeah.
Rifat, do you know about anthropometry?
Anthropometrics, you are talking in particular what parameter?
Yeah, so these scenarios of are of anthropometric
Yes,
measurement,
yes.
right? Okay.
Yes.
So, Dr. Rohit, will you set the time for us, please? So this is actually scenario case number 4 that this boy has cystic fibrosis and is malnourished. Comment on the cause. What can be done to help? So you will come do the assessment of his nutritional assessment, and he is case of cystic fibrosis and he is malnourished. So how will you examine and what parameters you will check?
Okay.
Dr. Rohan, will you set the time?
Me, okay. What's about this 6 minute? Huh? I will tell.
6 minutes and 9 minutes, yes.
Okay. Just 1 minute.
Okay.
Give me 1 minute. Yes, you can start.
Please wait for a minute.
Okay,
Okay,
no
no
problem.
problem.
Yes. Thank you so much for waiting.
It's okay.
Yes, you can start now.
Okay. Good morning.
Good morning, doctor.
I'm Rifat, one of candidate today, and I am going to check. I forget the name of the patient.
John.
I'm going to check the John. Is it okay?
Yes, doctor, sure.
Is it okay with you, John?
Yes, doctor.
Okay, that's good. Okay, so I am first gelling my hands, and meanwhile I am also looking at the surrounding. So is there any particular
There
device?
is an oxygen. Child is on oxygen connected with nasal cannula. Child is
Okay.
having nasogastric tube. He
Mm-hmm.
is looks very thin and wasted.
Mm-hmm. Okay. So
He's on the bed.
any weight scale or measuring tape or
Yes,
monitor?
there is a weight scale, measuring tape, and also
Okay.
there is a scale of measuring the upper arm. These all are there, and also there is a caliper for skin.
Okay. So, mom, is John hurt anywhere?
Yes, doctor. There is sometimes complaint of tummy pain.
Okay. So, John, right now, are you hurting anywhere?
Right now I'm fine, doctor, because they give me some thing to relieve my pain.
Okay, that's good. So, John, I will just check you and it will not hurt you. Okay. So,
Okay.
I will start with the first of all, I had a look of the child. Child is in distress.
Yes, he's in distress. Respiratory rate is his age is 6 years. Respiratory rate is 32.
Okay. And what about the any dysmorphic feature or
No, he's vested and thin.
okay,
Looks
fine.
anxious, conscious eyes
And
are.
what about the scar, skin?
No, he is with his clothes.
Okay, fine. So, John, can you please take off your shirt, or mom can help you as well?
Yes, doctor. So there is an intercostal recession, subcostal recession. There is a scar on the right side lower abdomen.
Okay.
Hmm.
So I would start my examination with the hands. Is John sitting or lying?
He's semi-sitting position.
Okay. So, John, are you comfortable with this position?
Yes, doctor, I feel fine because I have
Okay.
oxygen.
Okay. So, in the hands, koilonychia or leukonychia clubbing.
The hands having a colonychia.
Okay. And palmar erythema or pallar.
Yes, pallor is there, not
Uh,
repeating.
wa- okay. So, they are warm to touch or normal.
No, normal, normal.
And capillary perfusion time.
It is 3 seconds.
Okay. So, heart rate.
Heart rate is 120.
Okay. And widening of wrist.
No.
Fine. In the arms, any venipuncture site or petechiae or dryness of the
Yes, there are
skin, any rash?
multiple venipunctures are there, the cubic area, and he's connected with the IV line.
Okay. So any central line is there?
No central line.
Fine. And from the head, what about the hairs? They are thin, sparse, depigmented.
There is alopecia in 2 areas on the scalp.
So what about the area? Either there are hair ends are visible or not, or they are
Yes, it is
bald.
thinning. There are thin hair.
Okay, thin hair, but the base is normal. Like
Yes.
exclamation hairs are there.
Yeah,
There is
exactly.
no rash,
No,
bogginess, rash.
only no.
Okay. And what about the head? Is looks normal or there's frontal
Normal it
bossing?
is. No, no,
Okay,
it's
eyes
normal.
in the eyes. John, can you please look up for me? Pellar,
Yes, it's a pallor, bilateral.
jaundice. Can you please look down?
Mm,
Jaundice.
no jaundice.
Okay. In the can you please open your mouth?
Yes, there are
Oral.
some ulcers. Some
Yes.
ulcers. Teeth are good. Hygiene is okay. And there's some
Okay.
cheilitis over the lips.
And what about tongue? Stomitis or is there or not?
No, no, tongue is fine.
And ulcers are at what area?
Oral ulcer just under the cheek on the right side.
On the cheek. Okay. Is it painful? Does it hurt? John?
Doctor, when I when I take spicy food, it hurts.
Okay. And what about leukoplakia? Oral thrush.
No, no,
Okay. So in the neck, is there any swelling?
no, sorry.
Fine. And in the chest, any bleeding scar or
No, it's there's
pigmentation?
intercostal recession, as I told you, and he's having
Okay. In the
rapid
tummy,
respiration.
in the tummy, is there distension or not?
No, tummy is normal, but there is a scar on the right lower side of the tummy.
Okay. Is it transverse?
Yes.
Okay.
Six
And what
minutes.
about dehydration?
Okay.
Dehydration,
Mm, how will you check the dehydration?
a skin pinch.
Six
No, it's
minutes.
normal.
Okay. Edema, pedal edema.
No edema.
Okay. And anthropometric measurements.
Yes,
Height, weight,
there are
height,
parameters.
weight, and
Check it.
I would like to check the skin fold thickness with the caliper and the mid-arm
Which
circumference.
part? Which part of skin fold will you check? Okay.
Tricep skin fold thickness in the midway between the acromion and the olecranon process.
Okay. 6 minutes
The
already
caliper.
passed. No. So sorry.
Okay.
Sorry. This is not again. Okay.
Yes, I
So
also
you
got
should
that.
thank the John. Okay. So
Okay.
yes, please explain your
I
findings,
just
doctor.
examined 6-year-old John, who is who looks thin for his age. He is in respiratory distress along with the tachycardia, and he's having the borderline capillary perfusion time. On further examination, he's having the signs of micronutrient deficiency in terms of koilonychia, having pellar, and there are certain mouth ulcers are there along with the chillosis. His hairs on the there are two localized patches with the exclamation hair marks. That could be the possibility of some underlying autoimmune pathology, or it could be secondary to the micronutrient deficiencies. There is also a scar mark in the tummy. That might be the possibility that he had the gastrostomy in the past. On my further examination, he's having multiple
So, Doctor,
venipuncture sites.
gastrostomy on the right lower score of transverse.
I'm not sure exactly, but
But he's cystic fibrosis. Is there any surgery during childhood
yes, there could be a surgery
of
involving of GI, like meconium,
good
or
mechanical? Okay,
yes,
could be appendicitis, right? Okay.
yes. And I would like to plot height, weight on the growth charts appropriate for her age, his age
Mhm.
and gender, and the to measure the mid upper arm
So,
circumference.
what could be the cause of malnutrition in John?
There are multiple reasons. First of all, the anorexia due to the underlying disease process. Secondary, the malabsorption that is due to the deficiency of pancreatic enzymes, and leading to the diarrhea and uh,
Nine.
uh, losses. Plus, there is increased energy expenditure demand in
Okay,
terms of
thank you.
having frequent infections and the respiratory compromises. In this, there is another factor like diabetes mellitus, but at this age, it is difficult to say about
Okay,
it.
so how will you manage this case?
First of all, I would optimize her respiratory condition and treat the underlying infection and the cause of the respiratory distress. Then I would take the nutritional opinion and optimize the nutrition in terms of high caloric diet, in terms of increased protein and the carbohydrate with the medium chain triglyceride, fat soluble vitamins, and follow up regularly with the anthropometric measurements with the dietitian involvement.
What will you give?
Sorry,
What will you give to improve his health?
I would give to improve his
His weight?
uh,
What and
high
how?
caloric diet,
Wow.
high caloric
Okay.
diet, fat soluble vitamins, and the lipase enzyme replacement, and treat the underlying the exacerbations. And we can top
Okay,
up the
thank you.
feed through the NG or the gastrostomy depending upon the child's condition.
Okay, good. Thank you. So, Dr. Rifat, you did well, and it was actually malnourished child. So, you have to assess the nutritional status. So, nutrition, I saw 2 3 videos. They are saying the anthropometry measurement. The examiner want us to know about the anthropometry measurement, so which include weight, height, mid upper arm circumference, head circumference, and skin fold. And we should be able to use these tools. We are
Mhm.
not able to tell that this is and this we memorize the reading and values, because they are saying there are charts are available. You measure the
Yes.
weight and you will put on these charts, and you will measure. You should be able to know about mid upper arm circumference, how to measure, how to head circumference, skin fold with the caliper. Then you will put on the chart. Then you will tell the examiner that his height is below normal or above normal or standard height. So this we should be able to do in the nutritional status station.
Mhm.
So because before I don't know, today just I came to know the other thing which you all, other than this anthropometry, you all explained very well. And the thing is they want us to know why this child is having malnourished. As you mentioned all the things, it could be chronic cough and high demand of metabolic demand because of the high respiratory rate, and could be his malnourished because of his condition anorexia. And you also mentioned about diabetes. So all things already you mentioned, but regarding anthropometry, which is I think important in nutritional assessment.
So I just
So
said that
in
I will
and
check the anthropometric. So is it sufficient or not, or should I? because the
If
child is in
as I
distress.
told you, there is there as I told you, there is the weighing machine and
Yes.
this measuring tape and the caliper all there. So you should have to do even without asking the examiner.
Okay.
You have to do. But now virtually we should say only that skin fold, where you will measure the skin fold. How will you do the skin fold? Which
Hmm.
instrument will you use for the skin fold? Or which
So
instrument you will you use?
that is caliper for the skin fold thickness. What is
Yes, exactly.
how we should interpret the value? Because I read that there are the certain charts like Z score. You can interpret the value through this. I didn't get any particular value that is normal or not. Do you know? Is there any value?
Yes, actually there are charts. First of all, for example, you will measure the weight and you will write on
Yes.
the paper. Okay. So
Yes.
they will give you chart. In this chart, already the standard measurement is there. So we will see either this measurement is made with the standard or below or high. If it is not standard, so it means it could be below. So below there is a reading you will take there, and you will say that it is below the standard. So his weight is under, he is underweight. It's
Hmm.
same like height, same like mid upper arm circumference, same like skin fold thickness. So we
Hmm.
are not supposed to memorize the values actually. Only we will
Hmm.
just measure and put on the chart. So chart will tell us either this is having undernutrition or our
Okay.
nutrition obese and head
Okay.
circumference head is large than the standard or not. So these
Okay.
are the only things that we supposed to. The other thing, very well, you explain all the things about why he could be the malnourished and what you will do